what we have designed is a basic echocardiographic course, and the idea is to introduce basics of echocardiography for the beginners as well as people who are already doing echoes but would like to kind of cover it in more details and in a structured manner. So it's a structured course. So, like for example, we created this video where we actually show you how to put the leads, starting from the very basics, and then we take you further. So actually show you
When we look at
on a body as to how the heart is placed. So you can actually see that the heart's, placement, how the heart is placed in the chest. And when you open it, you see the structures, the valves, the mitral valve, the septum, the tricuspid valve, and its orientation. So the echo-anatomical correlation is extremely important for you to begin. And this video actually explains to you how you put your cursor. So when you put your cursor, how you get a 4-chamber view
here.
So this kind of basic, structure is what we have created, where something which is almost like a hand holding and showing you the echo-anatomical correlation. So that's number one. Going forward, we will show you how to the basic flaws which we see in echocardiographic picture today. So like, for example, how do you measure the volumes? Do you actually exclude the papillary muscles and the trabeculae or not? Then you have the 17-segment model, which looks at the various segments of the left ventricle. You have the coronary supply, which we will be, showing you and teaching you as to, what happens in anterior wall MI, inferior wall MI, or circumflex territory, LED involvement, etc. This is a suprasternal view where you can look at the origins of various great arteries, the arch and the carotids, as well as the subclavian arteries. This is the right parasternal view, which is very commonly seen or done for looking at the aortic stenosis. This is a large aneurysm of the left ventricle with significantly decreased LV function. But then how do you use modified Simpson's method to get the exact ejection fraction of about 16% in this? This is another view where you can see the inferior wall is completely scarred. The EF is extremely reduced, severe LV dysfunction. The diastolic function, so this is the right ventricular dysfunction. The PA pressures are raised. The PR, how do you judge the pulmonary regurgitation and the PADP? Then again, Simpson's method to look at the ejection fraction of 23%, looking at the diastolic function, looking at the RV function. Also, we'll touch upon a little bit of RV strain and 3D as we go along, though that's part of the advanced course. Then some spot diagnosis. For example, here you can see the posterior wall is involved and there's a large aneurysm of the inferior wall. So these are classical of sarcoids. So these spot diagnosis also we will be touching upon. Then you look at the clots. Look at this patient of SLE with hypercoagulability having apical thrombus in the RV as well as in the LV. And the use of contrast imaging to delineate these clots. So, this is a case of pulmonary embolism where the right ventricle is dilated. There is a D-shaped septum. You can see a clot here and here in the right ventricle. Also in the main pulmonary artery, and this is a saddle thrombus in the pulmonary artery, which is going into both the pulmonary arteries. And this is a 4-chamber view where you can see very clearly the RA and RV are dilated. So this is a classical acute pulmonary embolism. So we will be touching upon cases like these. These are very classical cardiac amyloid pictures where you can see a cherry on top appearance on strain imaging. So not only will we using the basics of echo, but we will also show you cases in between interspersed to keep it interesting. So in this course, and I'm sure it's going to be quite informative and will have a lot of structured, orientation to it. And of course, there will be a session at the end of the talks where you can ask your questions and we can have a real interactive sessions. Thank you.